It was amazing to be in a room where you had Buddhist, Baha'i, Christian, Jewish, Muslim, Sikh traditions, all recognizing that they are family, all recognizing that they are one, and coming to a common agreement. To me, that was quite amazing. The question now is, how are these leaders who signed, and I am one of them, able to live up to their promises of what needs to be done? And that's why we are here today in this conference. Each of our speakers this morning will look at the commitment and address the opportunities and challenges that religious leaders need to face in the response to HIV.
For me, the commitment that I made and which my organization made is about affirming the leadership of women and girls in the response to HIV and AIDS, affirming that women are taking a lead role in terms of providing information, in terms of providing services, but also in terms of an understanding of what are the actions that needs to be taken today and much more so now, both to prevent, to support, and to facilitate the kind of response that needs to be there. That for us to have a comprehensive response to HIV, we need integrated, comprehensive approaches that also address the issues of sexual and reproductive health and rights of women, and to concretely discuss some of the issues that create vulnerability, to talk about relationships within the family, what are the possibilities of women, and especially young women, to negotiate safe sexual relationships. We are also very much concerned about the issues of violence against women, especially sexual violence against women, and the issues around positive young women. And lastly, it's about the definition of our cultures and religions, and how we need to look at enabling and empowering definitions of our cultures and be able to address some of the negative interpretation of our religions and cultures which might create vulnerability and risk. So these are some of the issues which are very concrete, which are very important for us to confront the richness of our religions and our traditions and our cultures, but also to be concrete in terms of identifying some of the issues that continue to affect people in terms of stigma and discrimination. Thank you very much.
HIV is one of the most frustrating problems nowadays, not solely because of its physiological symptoms and complications that people living with HIV suffer, but also because of the psychological and social consequences. To help them cope with the disease at the psychological and social level, people living with HIV need the support of every educated and influenced personality, including religious leaders, and we consider the role of religious leaders to be as important as the role of governments, owing the great influence that they can have on people's perspectives and thoughts. All religions seek to serve people and spread the principles that allow live in peace and dignity. Religious leaders of all faiths have a vital role to play in response to HIV/AIDS because of their significant influence on all communities and on national policies. Their involvement will increase awareness, create a supportive environment for those infected with HIV/AIDS and affected, and to others who are working in HIV/AIDS field, and to address stigma and discrimination. Faith-based organizations serve all classes, races, and age groups. They are a credible source of guidance and possess a history of helping communities, which makes their involvement in fighting HIV/AIDS an ideal setting. Religious leaders have moved from an initial position of passive observation and ideological opposition to the promotion of key prevention and sustained commitment to fighting the epidemic. Let us learn from enlightened people how to make the religion a path to happiness and love, not a way to restrictions and discrimination. Thank you.
Since the 1980s, I have worked with religious leaders from a number of faiths as part of our response to those members of our community living with and affected by HIV. Through this time, I have experienced religious leaders at their best, and sadly, sometimes at their worst. HIV ensures that we are confronted by challenges of ill health, our own mortality, and the loss of our friends and peers. Too often, key populations, such as people who use drugs, have felt judged, condemned, and abandoned by religious leaders. However, we have also worked with some exceptional local religious leaders who have met us with humanity and compassion and ministered to our communities in our time of need. I would like to publicly give thanks and acknowledge those exceptional local leaders who've stepped forward and met us in that way. Input is committed to working with the Ecumenical Advocacy Alliance, CoreAid and UNAIDS to advocate to make the exceptional the standard and to help ensure that when our community seeks spiritual support, we are met with understanding, compassion and humanity. Input commits itself to this dialogue with high-level religious leaders. We hope this process will ensure that the global response to HIV includes the spiritual and pastoral aspects of our lives as people who have traditionally been viewed as other and outside. Thank you.
This is about accountability, to live up to, and you, Mr. Chair, for this press conference, you said you signed yourself, and now the challenge is to live up to what you have signed. And this is about accountability, of course, to live up to what you have promised at this summit and all the religious leaders at the summit. And this is about to include HIV and AIDS as part of the daily life in your religious communities, to be part of the daily life dialogue in your churches and other faith-based organizations, places where you meet, to show leadership here and breaking the silence. This is also, and let me conclude by that, this is also that challenging and supporting governments to meet their moral duty to implement their promises on HIV in their priorities, practices, and financial support. I'm reading from the commitment. I'm really looking forward to that, to see religious leaders play a role also in the dialogue with governments and other decision makers. And in doing that, also highlighting the more complex matters. So both taking the discussion within your religious communities, but also to do it in the dialogue with governments. And in doing that, reminding governments about most at-risk populations, we have heard about it today, about men who have sex with men, about people who use drugs, the LGBT community at large, people who sell and buy sex. All these complex matters that are difficult in society, but where the church or other religious communities can play an important role within the communities, but also in the dialogue and pushing the governments. So a very important summit in The Hague, very important steps taken by religious leaders, and I'm looking forward to see how this will be translated into deeds on the ground, because that is about accountability now for the religious leaders. Thank you.